100 questions in 90 minutes. So it's a time-pressured examination. And most questions will be in the format of, there's an arrow pointing to a structure. So you just type in the answer there, you name that structure. A few questions will test applied anatomy, such as, what goes through this particular foramen, or what nerve innervates this muscle, or what the blood supply to this muscle or to this structure. So the marking is based on how descriptive and how explicit you can be with your answers. So it's always good to be as specific as possible. So if you are able to answer with full accuracy, you get a complete 2 marks. If it's less accurate, for instance, you've got an arrow pointing to a structure on the left hand, for instance, and you fail to indicate the laterality. For instance, if it's left scaphoid, you fail to indicate the laterality of that, you might lose you lose 1 mark for that, so you get just 1 mark. And if you've answered incorrectly, either given the wrong answer or you've mixed up the laterality, for instance, you've got two structures in front of you and you've labeled right instead of left, so you won't be getting any marks for that. Overall, the pass mark tends to over around the 120s, 126, 125. The last sitting was 129, which was March 2026. So that's 129 over 200, which gives you about 64.5 over 100. So I just included these pictures here, just for you to have a brief look at what could be what the questions look like. For instance, this is an arrow pointing to the femoral neck, and in this scenario, they will probably ask, can you name the arrow structure? On the right-hand side, this is the obturator foramen. You can have an arrow pointing there, asking what structure goes through what structures go through this foramen. So it's always very important to read the questions and not just it's asking you what is this structure. So the exam is designed in such a way that it sort of covers the body systems in an equitable format. So 25% will cover the neurological assessment, like head and neck and the spine and the brain. 25% for chest and cardiovascular systems. 25% again for abdomen and pelvis, and the last being MS, the musculoskeletal, which is additional 25%. However, the modalities can vary. So virtually every single modality will be tested: CT, MRI, X-rays, fluoroscopy, ultrasound. Normal variants as well is quite high. There were a couple of normal variants in my exams, and I'll talk about that later. The common ones that you need to watch out for, as well as pediatric radiology, particularly the radiographs, and knowing when the ossification centers appear and at what age. There were a few questions on that as well. It's important to also know that fetal imaging and neonatal cranial ultrasound is not tested on this examination. There are some books where you might find this, but it's no longer tested on the examination, and that's spelled out clearly on the RCR website. So the strategy, I think this will depend on how you study, to be honest. Some people will prefer to start early being at the start of ST1, like in August of this year. Some might prefer to start later on towards the exam. The exam is usually the first sitting is usually in March. So some people might decide to wait till December or January before they start studying. Well, in my case, I think I started a bit early, probably around September or October, but I was able to gradually build up pace because the closer you get to the exam, you realize that there's actually a lot to learn in the anatomy as well. And also, depending on how sound or how good your baseline anatomy knowledge is, then it sort of determines how much you need to know. Which brings us to the issue of question books or anatomy texts. So what I would advise in this sense is that the question books are really good. You can use that to familiarize yourself with the question patterns and the common things they do ask. However, if you found some deficits in my example, for instance, I think I struggled with cardiac anatomy a bit, so I just used another anatomy text, which I will share in the next slide. I just read through that, probably a couple of pages, not everything in detail, just to brush up my knowledge. So you might want to consider that as well. Question banks, there are lots of question banks. There's Radiology Cafe, there's Radiology Vibes Academy, Revised Radiology. But in my opinion, I found Vibes and Radiology Academy closest to the material, to the exam, in my opinion. I think Vibes was even much more, in terms of the difficulty level, I think it was much more consistent with what I saw in the exam. Other people might have a different opinion, but you can have a look at these two question banks and decide for yourself. But I think this, if you're able to go through academy and vibes, you should be good and you should be fine for the exams. Reporting at work also helps. Like I know different deaneries have different training schemes, but overall, the more you report, the more you get very, very familiar with the anatomy, to be honest. And you begin to see things in different planes. You're able to see, you know what it looks like on the axial or sagittal reconstructions or coronal reconstruction, because the exam wouldn't just focus on a particular plane. You get structures, you get assessed in different planes. So you must be able to sort of recollect what structures looks like on different planes. Normal variants. So there's a section on Radiology Vibes and Radiology Cafe where you can find a list of the commonly tested normal variants across all the systems. So I would implore you to have a look at that as well. YouTube was also quite useful. There's a channel on YouTube called Radiology Tutorials. He also has a physics course as well, which I think Iyanu might talk will talk about. Um, for the tutorial, you can have a good look the anatomy aspect where it gives the shots. The videos are quite short, about 20 minutes, 15 minutes, or particularly on MSK, elbow MRIs, shoulder MRIs, the plain films as well. I think this sort of helps you to narrow down what you need to know for the exams as well. The other channel I would recommend is called the Neuroradiologist. So this is very, very good for MR, CT brain anatomy as well as temporal bone anatomy, which found to be quite challenging, particularly temporal bone anatomy, and it's also high yield. So these were the resources I used for my preparation. I went through this. It's called a green book. I used this first. Then after completing that, when I had more time, I just used passing the Frcr pass on cracking the anatomy. So I just sort of consolidated whatever I've learned from the green book. I use the atlas as a reference when I come across structures I'm not familiar with. I just look them up in the atlas. And the last book is a textbook of diagnostic imaging for anatomy for diagnostic imaging, which I just use as a reference text as well when I want to brush up on my anatomy, basically. So it's not like I read through the whole book, which I don't think is advisable. To my personal experience, it's like I mentioned earlier, it's a time pressured examination. You got an average of 0.9 minutes. That's approximately 1 minute per question. So you need to, if it's something you know, yeah, you need to type in the answers quickly and accurately. If you don't know, just move on to the next question because you haven't got lots of time. Plain films are quite high yield, chest x-rays in particular, know your cardiac borders, know the pulmonary arteries on the chest x-ray, the AP window, aortopulmonary window, recess, know the anatomy of the ribs as much as you can as well. Because I recall there was a question pointing out to the coastal cartilage of one of the ribs specifically. So know as much as you can on the chest x-rays. MSK radiographs, upper limb, lower limb, pediatrics, they test that quite often. There were lots of radiographs in the exam. Ultrasound, I could recall about 10 questions around about that from ultrasound, particularly ultrasound abdomen and KUB. The common things they tested were the pancreas. You will have an arrow pointing to a particular part, either the head, the uncinate process, or the tail. I know there was another one for the common bile duct, if I remember. So these things you need to familiarize yourself with on ultrasound as well. KUBs, the kidneys, the specific passages, as the pyramids, the cortex, the left renal vein. There was a question about the left renal vein. So this you'll find in the question books as well. So you just need to familiarize yourself with how they appear on ultrasound. MRI is quite non-specific. They could test anything, but from my experience, the shoulder, rotator cuff muscles, pelvic muscles, particularly the lower limb muscles, the three groups affecting us, the adductor components as well. So these are things that you should be quite familiar with. CT is also non-specific, but the skull-base foramina and the contents of the structures going through them. There were a couple of questions on that. And bronchopulmonary segments, if you can. I know it's quite challenging to learn them, but you can try to learn as much as you can. And then towards or close to the exam, just refresh that before, probably a day before the exam. Abdominal wall muscles, yes, you can get tested on that. Then fluoroscopy, the anatomy of the hypopharynx on fluoroscopy is also high yield. That is the valvular and the piriform sinuses. Also remember the esophageal impressions, the impressions of esophageal, the um, aortic arch, the left main bronchus, left atrium. These are things that are commonly tested. And your normal variants, I do recall there was a question about cervical rib. That is very, very common. pectus excavatum. There was another one of trachea bronchus. So this were just basically those common things I could recall from my experience of doing the exam. So what are the common pitfalls that can that lead people in the wrong direction? One, not reading the question, because we just as we've seen an arrow and it's pointing to a particular structure. It's always important to read that question. It could basically asking what passes through this structure, what passes through this foramen, and if you just answer that as for instance is the obturator foramen instead of the obturator nerve and arteries, you will lose. You're losing mark for that. Be as specific as possible. So if you look at where the arrow is pointing, particularly in MSK, is it pointing to a tendon or is it to a muscle? Because if you're more very specific and you say it's for instance the right supraspinatus tendon, you get your full marks. Or if you say muscle instead of tendon, then you'll be losing marks for that. Avoid acronyms and abbreviations. Write in full. For instance, superior mesenteric artery, superior mesenteric artery. Do not use SMA, or if it's celiac artery, it's celiac artery. Don't use CA. Don't use abbreviations. Laterality is very, very important. It's a common error. Now I will need to be quite clear on this. For you to be able to confidently spell out the laterality in the exam, usually it has to be a structural organ that is paired, right? Either the kidneys which are paired, or you've got MSK radiographs of the hands, which is common, and it's pointing to a structure probably on the right hand or the left hand. You need to mention the laterality in this case and be specific. There are some situations where the organ is paired and they'll probably just give you just one side. And in that situation, look around. Sometimes they put the body markers there, or they anonymize it. And if, for instance, if it's a radiograph, you might say R indicating is the right one, or L indicating the left. So you need to be on the lookout for that. If you can't see any, if the structure, the image is not paired, and you can't see any labeling attached, you're allowed to just mention without indicating whether it's left or right. So for unpaired structures, you also need to be very, very specific. There are some structures that have got multiple parts. For instance, the vertebra, you've got the pedicles, you've got the vertebral bodies, you've got the spinous process. So look at where the arrow is pointing specifically. If it's pointing to the spinous process, write as spinous process of, for instance, L1 vertebra. If it's a vertebral body of L1. If it's the pedicle, the right pedicle or the left pedicle of L1. So you have to be as specific as you can to get the full marks. Another common one is a mandible as well. So we've got just one mandible. It's not paired, but the structures you've got are lateralized. So you can have the right ramus and the left ramus. You can have the body, left body or right body, but it's still one single mandible. So if you have an arrow, for instance, pointing to a structure probably on the left side of that mandible. So you can just say left body of mandible, because the mandible has also got the right body on the other side as well. But it's wrong if you say body of left mandible, because you've got just one mandible. So it's not like you've got left mandible and right mandible. So it's just one. So it's just that structure has got parts that are divided into left and right. So you need to be wary of that. And spelling mistakes. Quite commonly, yes, you are typing and you're in a haste as well. But you need to be careful of spelling this, particularly in structures that sound alike. For instance, ileum, which is the one with the E, refers to the terminal part of the small intestine. While ileum, which is the bone or the iliac bone. So they can sound alike, and the spelling can be quite confusing as well. So that brings me to the end of my presentation. It's a very short one. So if you've got any questions at all, you can just pop it in the chat and I'll respond.
Wow, 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 wow. Fantastic. Fantastic. Thank you so much, Dr. Abdul-Sabr. That was quite insightful. I mean, you address salient stuff and even things that could easily have been overlooked in the preparation. So I hope we all have gotten that. Issue on laterality, and you have just mentioned something very vital now. The issue of semantics in naming and anatomy, that like that mandible of a thing. So of course, under pressure, you can easily say left mandible, but we don't have we don't have such anatomy, but rather the left body of the mandible. And then, of course, typing skills will be very required here as well too. It's highly required to. That's something to pay attention to as well. Understanding that you have less than a minute to answer a question, so you've got to just be familiar with the keyboards and know how to put in your letters very quickly. So, and of course, question banks, that cannot be overemphasized. I'm sure Dr. Yan is also going to make mention of that as well too in physics. So, if you have any questions, so thank you once again, Dr. Mayowa. That was really very helpful. If you have any question or concern or anything that you might want to clarify further, you could leave that in the chat box. After the talk on physics, we would take everything together and then they'll be able to help us shed light in those areas. So I think we should give the floor to Dr. Iyanoluwa Oderinde now on the physics talk. Thank you once again.
Hi guys, can you hear me?
Yes, yes, you are
Okay.
audible. Yeah.
Okay, I'll just share my screen. Can everyone see my screen, sorry?
Yes, coming up.
Okay. Right, it should say Frcr Part 1 Physics on there.
Yeah.
Okay, perfect. Okay, hi guys, my name is Iyanu. I'm one of the ST1s currently in Sussex, and I'll be talking about the physics part of the Frcr Part 1 exams. Like Mayowa said, it's the first of 3 FRCR exams along with an anatomy. And I'll be following this outline roughly, just talking about the exam overview, some of the resources available out there and some of the ones I used, my personal experience with preparing for the exam and actually sitting the exam, and any questions you have at the end, I can answer as much as I can. So there are 3 sittings for the exams every year. The first is in March, which is sort of like the main exam. The opportunities to sit in June and September as well. In terms of the financial expenses for RCR members or trainees in the UK, it's about £400 thereabout, and for non-members, it's about £600 roughly. And their centers in the UK as listed. I start mine in London, but there's others in Egypt, India, Pakistan, and the countries listed there as well. It's a true or false exam, which can be tricky, but also can be a good thing because you have an element of luck on your side. So if you don't know an answer, you can guess and you'd be right, but you could also be wrong. It's a 50-50 thing. There are 200 questions in total, 40 questions with 5 stems, and you'll have true and false, and you just have to sort of select one that you think it is. And it's over 2 hours, which means you have roughly 3 minutes per question. Again, there's no negative marking, there's no penalty for incorrect answers. So the advice is that you answer all the questions as much as you can. In terms of the results, you tend to get the results within 3 weeks of sitting the exam. They will send you the score, which is about 200. And then they will send you a breakdown, a detailed breakdown of the exam as well, depending on how you performed. Some questions are removed at the end of the exam, depending on how candidates perform in general. So in our exam, 2026, this is supposed to be, they removed 3 questions. So the overall score was over 197. And the pass mark tends to be around 70 to 75%, generally around 75%, I would say. These are the pass marks over the past 2, 3 years, generally 150 to 156-ish. And I've left a link here just to have a look at the pass marks dating back to 2020. In terms of the syllabus, there are 7 parts, 7 main sections. Some basic physics on matter and radiation, ionizing radiation, the electromagnetic spectrum, and things like that. There is a section on radiography and fluoroscopy. That's essentially X-rays and angiograms and digital subtraction things and all of that. There's one on PET and SPECT, that's the radionuclide imaging or nuclear medicine. Radiation safety, that's the regulations and the guidelines that guide ionizing radiation, essentially. There's a section on CT, MRI, and ultrasound, and the number of questions are listed in brackets. You usually would have an additional question. In my sitting in March, it was on MRI, but it could be on any of the other sections. So yeah, we had seven MRI questions. I would recommend just going through the FRCR website. I've left some links here, and I can send a slide afterwards if you would like to have them. Just looking at what the aim of the exam is and what the recommendations from the FRCR are. And I think there's some sample questions on the FRCR website as well that you can go through. So yeah, in terms of how the exam is structured, what they test mostly is in the basic physics, just atomic structure, the different models of the atom, the electromagnetic spectrum, ionizing radiation, and how that interacts with matter, Compton effect, and all of that. I've forgotten most of them now, actually, because it's been 6 weeks. But yeah, that's what they test on the basic physics. And in terms of the different imaging modalities, X-ray, fluoroscopy, CTs, MRI, they test your knowledge of how the image is acquired from source to detector. So how X-rays are formed, thermonic emission, and how the X-rays are detected. They also assess factors that affect image quality like resolution, temporal resolution, spatial resolution, contrast, signal to noise ratio, and artifacts. The bulk of your exam is going to be on this. So you need to understand what factors affect image quality for the different modalities. And another important part of the exam is safety. So you need to know what are the risk factors associated with the different imaging modalities, radiation dose. With ultrasound, you need to know thermal index, mechanical index, and with MRI, you need to know things like the ferromagnetic missile effect and things like that. So you need to know and understand safety and how we need to and the guidelines underlying safety in radiology and physics. So allow that stay as well as reasonably practicable and the different guidelines underscoring the safety factors. Down to the resources available and some of the resources I used. FARS is considered the Bible of FRCR Part 1 physics. But the issue with FARS is it's a difficult book to read on its own, which is why most people tend to not go with FARS, at least not as the main text or not as the first book. The other book people tend to use is this, it's called the Radiology Cafe Notes, or the Sarah Abdullah book, which is what I call it. You can find it on Radiology Cafe. It's easier to read. Basically, these two guys sort of just read FARS and came up with notes that are easier to read, bullet points. So I used this for my first go, and I'll explain how I went about it. I used FARS as well, but I used this as my main text. The other books available are this is called Prometheus book. It's easy to read. It contains humor. So if you're the kind of person who likes to read easy books with some jokes and stuff like that, then you can use that as well. But I only dipped in and out of it here and there. I didn't use it as my basic or main text. I wouldn't recommend it either because it's not as relevant as these two are. But if you have concepts that you need to clarify from these two, then you can obviously dip into that. And for MRI, again, people tend to recommend the MRI Made Easy book. Again, I did not use this, and I'll explain how I went about preparing for the exam. And another summary from a radiologist to start the exam is this radiologist's notes on physics. It's again bullet points, easy to read. I just dipped in and out of this as well. I didn't use it as my main text. And another, I've left this here. It's lecture notes from the Mersey physics course from 2016. It's quite detailed, and I also use this as a main resource. All these resources you can get on the Riga folder. I don't know if you would have them available to you, but all the resources are on the Riga. Sorry. Oh, okay. Yeah, you can find all these resources either online on the Riga folder. And then I've left a link here for something called the RITI module. Essentially, the RCR created a website for trainees or members where you can, it's kind of like all those online courses where you just go over them one module after the other. And there's one on physics as well. I tried using this as well, but it was a little too much for me, so I just stopped after a while. But if you like to do modular exams, I don't know if that's if how best to explain it, but you can check online and see if that's for you. I don't know if for non-members you would have to pay for this. I think you'll probably have to pay for this. But if you're in the UK, training in the UK, then it's free, and you can have a look and see if that's for you. It wasn't for me, and I wouldn't recommend it either. But you can have a look and see if that works for you. The main resources I used was this man here is a lifesaver, and I highly recommend that you check him out. It's called My Canal Radiology Tutorial, and he has all the, well, not all, but he has most of the sections covered. I think the only sections missing were nuclear medicine and the radiation protection guidelines, the IRR and the IRMA. But he has another course called the Learn Radiology Physics, where it covers some bits and pieces of that as well. I use this a lot, and I'll definitely recommend it for your initial knowledge gathering phase. Definitely go through that. Another video course that I used was Radiology Strategy. This guy is a consultant somewhere in Kent, I think, and he created some videos covering, again, all the basic parts of physics. It's not as detailed as McKennell's course, but his is more exam targeted, exam focused, and shorter videos as well. So I used this a little closer to the exam, and it also contained parts that were missing from my canals. So I would recommend checking Radiology Strategy out. I think you just have to message him, and it's free. That's the good part of it, it's free. This is also free on YouTube and Radiopedia. And this is it's a YouTube series by Michael Lipton. I think he's a consultant somewhere in the US. One of my consultants recommended him really good MRI talk, but again, it's long videos, about 1 hour long videos. I only dipped into it for like case space and some other bits and pieces, but I didn't use it as my main resource. This was my main resource, my canal radiology tutorials. Question books. Again, I didn't use question books in the traditional sense of it, but people recommend using all these question books. It's quite a lot, and some of the question books contain mistakes or errors that you would have to sort of figure out for yourself, and sort of reference from FARS. People tend to recommend this Ilias book if you were to use just one book. But again, I didn't use these books individually. This is also good, and this is quite old. It's called the Oxford book, but it's also said to be very good. I don't know, that's the honest answer. But yeah, just if you have a look at all the different question books, then you can sort of decide for yourself which one works for you. Again, all these books are in the Riga folder if you want to check them out. What I did use was Ankidex, and apparently the Ankidex, again, in the Riga folder, are collation of all these question books. What I couldn't tell was where the questions came from. So I couldn't say if this question was from this book or that book. But again, it's a collation of all the questions. So the thing about Anki is it allows for spaced repetition and you can sort of gamify it. So you have a question like this, and you have a space, a box where you can sort of type in true or false, and you get the answer and an explanation down below. You can sort of scroll through with diagrams. And I found this very helpful. There are a lot of questions, as you can expect, because you have 7 books with 30, 40 questions on each section, but it's really good. And the answers are referenced from Rad Cafe book as well. So I found the Anki Dex very helpful, and I'll recommend that. And there are online question banks as well. Again, Mike and Nell's Learn Radiology Physics I used towards the end. It's quite expensive, but I think it was doing a discount at the time. It was about £25 earlier in the year. So I sort of did that, but now I think it's back up to about £100. So I don't know if you would want to pay for that, but if you can, definitely have a look. It has 10 marks of 200 questions each, and it's quite representative of the actual exam with good explanations, and there's some notes attached as well. I would look into this if you can afford the fee. Another question bank I used was FRCR Exam Prep. They have different packages. The 1 month package is about £29. I think the 9 month package is about £80. So I used the 1 month package towards the end of the exam. The questions were fairly easy compared to the actual exam, so I don't know if I would recommend it. It's good for just practicing answering questions and going over the topics again, but in terms of how close it is to the actual exam, I don't think it is. There are other question banks out there, Revise Radiology, the BMJ has something, and there's some sample questions on the RSR website as well. I didn't use any of these, but again, just have a look, decide for yourself what works for you. But my recommendation is my canal and maybe FRSR exam prep down. And the courses, so there are many courses again out there, but the most recommended courses are the Mersey Physics course and the Leicester course. I did the Mersey course. It's organized by the Liverpool Training Institute or something, and the main guy was a previous examiner, so he has some insight into how the questions are formed and what is high yield versus what is not high yield for the exam. It's a bit expensive. It's £160. But for us trainees in the UK, it was covered by our study budget. I don't know if it's going to be something you want to look into, but I'll definitely recommend it. If you cannot afford the course, again, the Riga folder contains slides, the lecture notes, and I think there's some mocks as well from previous years. They might be old, but they're still relevant. So definitely have a look at the Riga folder if you can access it. It's organized at the end of January, and it's over Saturday and Sunday, 9 to 4. The course itself wasn't very helpful because he basically was rushing through the different sections in hours. It's good if you've covered all the topics and you just need a refresher. But if you've not covered the topics and that's your first time, then a lot of it's going to go over your head. But what was really helpful was the mocks and the slides that he gave with some high yield summaries. The Leicester course I've heard is also really good. I didn't do this and I have no idea how much it costs or how it goes. Again, the Riga folder contains previous slides from the Leicester course. I think I used one of the ultrasound slide and it was really good. So I would recommend having a look at that as well. And the RCR also has a 2-day course that they do at the end of January. Again, I didn't do any of these, but you can just have a look at their websites and decide for yourself if you'd like to do that. In the UK, we have different academies and they organize like weekly teaching sessions. And we had a mock as well. And the mock was a collection of past papers and it was quite closely representative of the actual exam. If I can get hands on that, I can send them to the RIGAF excos and they can share them as well. But I'd recommend having a look at them if I can get my hands on them. Right. So in terms of actually approaching the exam itself, I would recommend starting early. Early, I mean November. Most people tend to start around November-ish and give yourself about 4, 5, 6 months. It depends on your personal circumstances, of course. If you have a family you have to look after, or if you have work you have to do, etc., you have to decide for yourself how much time you need. You might need longer, but you also need to avoid burnout, because if you start too early, you forget things and you get burnt out. But so you want to give yourself that sweet spot of about 5 months, I would say. And it also depends on how you like to learn. If you like to cram things towards the end, then you can do about 3 months. People start in January and pass the exams. But if you're like me and you like to take it slowly, go over things again and again, I'll definitely say start about October, November-ish. I started in October. So yeah, that's my recommendation on preparation for the physics. I sort of divided it into 3 or 4 phases. The first 3 months were just getting the gist of the different sections. So for that, I used the radiology tutorial videos and the RadStrat videos that I mentioned earlier. And my main reference text was the Rad Cafe notes. So what I did was I would listen to the video, make notes as I went along. I would read the Rad Cafe notes, divide the book into two and write notes on the side. And then at the end of every section, I would sort of start doing Anki decks just to sort of consolidate the information and space out repetition and things like that. So that was what I did for the first sort of 3, 4 months. And then, sort of at the end of that knowledge gathering phase, the music course took place. That was in January. And it sort of now gave me the high yield points to focus on towards the last 6 weeks of preparation. Um, and after that, I then started doing question banks and the Yankee decks a little more seriously. This time around, my reference was FARS. So because I had gone through the knowledge gathering phase, I understood what was I needed to know, and then it was then much easier to read FARS. Some people go through the exams without reading FARS, but I'll recommend reading FARS. A lot of the questions came from FARS. I remember a paragraph lifted directly from FARS because I went through it the morning before the exam. So definitely read FARS if you can as the main text. If you can't, towards the end when you're doing your questions, then use FARS as your reference text. And then the week or two before the exams, I repeated the different mocks, the Mersey mocks. I think the Mersey mocks, there are four mocks with 150 questions each. And I did the RAD tutorial mocks, the 2000 questions. And I just read the Mersey slides and my personal notes. I went for the exams. Um, in terms of the exam technique, what I would say is, again, it's true or false. There's no negative marking, so answer all the questions. Don't leave any. If you don't know a question, guess. If you can rationalize it, think about it from first principles. Okay, do I know a part of this? Can I reason it out? Can I draw a diagram that helps me answer the question? Then do that. If you have no clue at all about the question, then a good principle is that if there are absolute statements, must, always, only, never, they're almost always false. So your best guess will be to go for false in such questions. And when you start doing questions, you will see for yourself. And the exam is hard because the phrasing of some of the questions can be tricky. So you need to read the questions carefully. They use some double negatives that you need to sort of think about carefully. They change the units. So instead of millisieverts, they change it to sieverts. So instead of milligrays, centimeter square, they change it subtly to like a forward slash. So you need to pay attention to those subtle unit changes. And another thing about the questions is sometimes there are two halves to a question. One half might be correct and the second half is wrong. So if all parts of the question are not correct, then you want to false it as well. So you need to read questions very carefully. And in terms of assumptions, sometimes they change a parameter, so they change the KVP or the MES. If they mention that one parameter was changed, you want to assume that everything else was kept constant when you're making your final decision. In terms of time management, I think the exam time was enough. And from my own personal experience, it's 2 hours. And the downside to that is a lot of people then tend to go over questions again and again, and they start to change answers. And you want to sort of avoid that, I would say. And in terms of just logistics in general, you want to plan well in advance where you're gonna stay, eat well, sleep well, and all of that, shebang. So yeah, that's all I have for the physics part.
Wow, 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 wow. Thank you so much, Dr. Iyanoluwa Oderinde. We are being heavily educated on this module. Thank you so much. So, few things to few points to remind ourselves of the things you mentioned about membership. So, if you are able to, particularly for those who are not UK trainees, if you are able to sort out your RCR membership, that will give you access to some subsidy on the exam fee. And also, you are going to have access to some learning materials on the RCR website. And that would be useful for both anatomy and physics module. And then I think by that also you should be able to gain access to written modules. I think for IRR and IRMER, the ionizing radiation regulation and medical exposure regulations, written modules are very, very excellent at that. And of course, it's well tested in the exam. And then for those of us who are not UK trainees, it's important to know that screen film radiography is not tested in FRCR at all. It's not part of what is listed. It gave us the topics, but I think it's just radiography generally that it's put in this section. But screen film radiography is not part. That has been stricken out of the syllabus for a while, and it is not tested in the exam at all. So if you are in non-UK training preparing for the exam, you don't have to bother your head about that. And then generally altogether, I think question banks are an important issue or important points common to both modules. For me, I think question banks get you into the mode of the exam. The mode of the exam, it kind of give you, kind of set the pace for you. So if you are able to lay your hands on the IED one, that would be very helpful. And of course, no negative marking for both modules, whether anatomy or physics. So feel free to attempt any question and wish yourself a good luck. Yep. So I think that's by that I'm able to uh, summarize a little bit of a lot of things that have been said. This session is recorded anyway, so we can individually have a look at a later time in case we may want to forget anything. So I think at this point it's good we go through the questions that and concerns people have left in the chat. So I'm just going to be reading them out and I channel them in the right direction for response. Dr. Maureen is asking if you must type your answers or is there an option of writing your answers? I mean, I guess what she's trying to clarify is if the answer for anatomy has to be typed or there's an option to handwrite it. Dr. Mayowa, if you may want to address that, please.
Yeah, so
Okay.
it has to be typed. So
Okay.
it has to be typed. So yeah, so usually the question you see the arrow pointing to the structure or asking you what goes through this. So you need to there's another like a column beside it that that you can click on and then you type in the answer. So you don't have to handwrite it, you just have to type.
Yeah, so please, we just have to sort that out. Unfortunately, the exam board or the organizers don't understand that somebody is not good with keyboard or doesn't know how to type. You just have to, you just have to get yourself prepared. Yeah, maybe it's Beacon or something could help well ahead of time. Okay. Dr. Abdul-Salam is also asking that after passing the FRCR exams, will is there going to be opportunity to practice in the UK or overseas? Thank you very much. So I think that could go either ways. Anybody,
Yeah,
anyone we
I
want
think
to, yeah.
I think
Mhm.
the FRCR is recognized in most countries except the
Yeah,
US, if I'm not wrong.
yeah,
So yeah, I think it's recognized in most countries except because the US has got a different training scheme. So you should be able
yeah.
to practice in other countries apart from the UK.
The US is a little bit stubborn. So in most other countries, yeah, it's a well-recognized exam in short. Yeah. And then with FRCR 2B, you can do GMC registration as well, right? So even if one doesn't want to go through PLAB, yeah, so you'll be able to practice in the UK and elsewhere. Then we also have Dr. Anas Abdullahi asking the process of booking for the exams, logistics, and estimated financial costs. Uh, Dr. Mayowa, can you help with that? Maybe just some brief, or Dr. Oderinde, anyone, uh, just some
Yeah,
brief
so
overview of the course.
if
Yeah.
I recall clearly, booking the exam,
Mm,
I think the timing is quite different from UK trainees and non-UK trainees. I
mm,
think the slots are initially open to the UK trainees, then
mhm,
probably a week after or so, you get booking dates for the non-UK trainees.
mm,
And like Iyanu said, I think he has a slide on the various centers globally. There's some centers in Africa, I think in Cairo. I'm not sure if there's one in Ghana or not.
mm,
The estimated financial cost, I think that depends on are you taking both parts of the exams or just one module? Where you need both modules actually to get the exam out of the way. So I think in total, for both modules was about maybe 630 for UK trainees. I am
mm.
sure it's a bit higher than that for non-UK trainees. I'm not very familiar with the exact cost for non-UK trainees, but I'm sure it's probably about £100 or £200 higher than that for UK trainees. And the
Okay.
logistics, I think it depends on where you are actually. And if you're in the UK, then yes, you can easily. I mean, even if you're not a UK trainee, you can still find centers in the UK. If you're outside the UK, it depends on where you are. There's a center in Cairo, I recall. Apart from that, I'm not very familiar with the other centers, but I know Yano has a slide that contains the list of centers, so you can have a look. Another good place to get this information is the RCR website itself,
Mm.
where you can get detailed information about the costs, the timing, exactly what time and when the booking will be available, and also the various centers globally.
Mm. Yeah, thank you so much. Dr. Yanu, is there something you
Yeah.
may want to contribute to that? Uh,
No, I think mine was answered correctly.
okay.
So from what I gathered, ours was about £399 each for
Mm,
both for each exam. So it came to about almost £800.
mm.
And then for non-RCR members, it was about £600 for each exam. So it's like 1,200, which is a lot to be honest. But yeah.
Yeah, so thank you so much as well. So if I may just add two words to that. So in terms of booking, I think what really makes a difference will be the membership. So as a member of RCR, just like Dr. Mayowa had mentioned, a week before, I mean, there will be an announcement of when the uh,
Yeah.
booking is going to open. The members have access to booking then. Of course, UK trainees have access to more centers on their booking platform than a non-UK trainee. But being a member of the RCR, you have access to book then, and then you may be able to choose more. I mean, you may have more centers to choose, and at the same time, of course, the cost is subsidized for members. Then a week after, usually will be when the booking platform will be open for non-members. So the membership has such added advantage as well too. Yeah, and of course, in terms of cost, just like Dr. Yano had mentioned, so there's 399 recently. So I think the exam cost goes up. Like there's usually like a review of it, and an in-forward review or added review, so to say, if you understand what I mean. Usually every year there will usually be some pounds being added to the fee. So the earlier one gets it done, the better actually. I'm not sure it's ever going to be getting cheaper. Yeah. Uh and then we have this question on UK prioritization as well. So someone, Dr. Okweoluwa, think this is the most trending thing now, asking, considering prioritization of UK MGs over IMGs for training slot and jobs, do you think this prioritization will extend to consultant jobs? And if so, is there any advantage to getting the FRCR certification? I'm not sure if I get that part of the question, or any advantage to getting the FRCR certification. So, yes, facilitators, is there a word? Do you have a word to
So,
that? Yeah.
so this one is more political than anything.
Interesting.
The honest answer is
Agreed.
I don't think
Mhm.
anyone knows, but the way things are going, I think it's going to affect consultant jobs at some point.
Mm,
At the moment, it's just training programs, but who knows?
yeah,
Maybe when we finish training, then they will prioritize. But I don't know the answer. That's the honest answer to that. I don't know if Maiwa has something. But
yeah.
like Maiwa mentioned earlier,
Mhm.
having the FRCR certification helps to get jobs as consultants in other places as well. I think Australia, New Zealand, just
Dubai.
not the US, Dubai, yeah. And you can also do like telereporting with Medica
Mm-hmm.
and things like
Mm-hmm.
that with the certification. So it's definitely still a plus, I'll say.
Yeah, great. Great. So, in my opinion, too, I think the prioritization has always been just that probably just getting on paper this time around. It's like it's going official now, So, and I don't consider it a strange thing really, because I think it's a phenomenon that happens everywhere, even in our Nigerian training institution as well. It's just that now that the Japa wave is really putting more pressure on our institution now, turning them to be non-selective like before. But I think it has always been a thing. So, in my own opinion, I think I would just advise anyone to, just do your own stuff. Okay. if you wish to get the FRCR, regardless of anything, just get it. Sharpen your skill, hone your skill, uh, make your portfolio beautiful. I don't think anybody can easily look away from excellence if one is sane. So uh, that would be a mindset I think I should borrow anybody on this matter. Yeah, so there will always be a way. Okay. Right. Yes, someone is asking if they can access the Riga folder. Yes, of course. It's just that for copyright issues, we do not put the materials out there for everybody to have access to. So, but there is a link. Thank you, Dr. Yanu, for making use of our link, and you referenced it a lot. We appreciate the publicity and testimony. Yeah. So, if you have booked the exam or you are ready to see the exam, you could reach out to us. You could reach out to any of the national representative on it. And if you do not have, or if you couldn't figure out the national representative number, if you put it on even the WhatsApp group where you are, that you may want to have access to the Riga folder link, we can take it off from there, and then refer you to, I think, the General Secretary. And of course, she may demand for a proof of booking or something, just to ascertain that you really want to write the exam. Then access will be given to you. Right. So that's how it is being operated at the moment. Like I said, it's basically for copyright issues, and I think we have to be very careful that way. Yeah. Uh, okay, so the Riga membership form link is being posted already, is right on the chat box. So if you are not a member yet, please use the link, and then by it you'll be able to join the appropriate WhatsApp group where you can get the relevant information for your progress. What else do we have there? The feedback from Dr. Naade, if you may. Okay, sorry. I feel this week's back, it won't let me fill it again. Okay. Slide via email. Yeah, so Dr. Naade address this will be shared on our WhatsApp pages. Okay. Yeah, so Dr. Ahmad Hussein is thanking Dr. Mayowa and Oderinde for the fantastic presentation and elucidation. Yeah, thank you. So he's asking, what pathway did you both get into ST1 Radiology UK? Is this something you want to share with us here, or they should the person should contact you, or are you happy
No,
to
it's
share
okay.
with us?
I
Okay.
think prior to the introduction of the prioritization, I think prioritization came into full effect. I think this recruitment batch. So I got
Yeah.
in. I think Yanu got in last year as well.
Mm,
So then it was the application was open to everyone, regardless of your immigration status. So you apply for the MSRA. That's a multi-specialty recruitment assessment. And
mm,
based on there's always each specialty has got like a cutoff for interviews. So I think that year radiology is probably 550 or 540 something. So anyone scoring at least 545 or 550 gets an interview slot. So I think 800 people are invited to the interview for a slot
mm,
of is it three something? So from the interview, the interview is done over a couple of days, 3 to 4 days, not individually. So it just spread because there's a huge number of candidates to assess. So it lasts for about 20 minutes. And after that, a few weeks later, you get your interview results, and you also get your ranking. So everyone gets a rank based on your performance in your MSRE
mm,
exam, the interview. So if you rank quite high, yeah, your chance of getting a slot is very, very, very high. If you don't rank very high, you can still get, if some people leave, probably renege on their application and probably go into other specialties. So, and but with the introduction of prioritization in this particular recruitment or the last recruitment window, it's changed the balance a bit because they considered British citizens and people with ILR as a priority before other people. So, and usually by the time you consider those two groups, there is hardly any slots remaining for the non-ILR immigrants or some of us who are still on the visas. So that's just the significant change that happened between this year and last year now. So prior to this recruitment window, it was open to everybody. So once you have your MSRE out of the way, then interview, if you're successful in the interview, then you get a training slot.
Great. Dr. Iyanu, any addition?
No, that's essentially the same as me.
Okay. All right. So, Dr. Ahmad Hussein, I hope you got that, and any other person may be interested in the process. That's fine. Thank you very much. So someone is asking if Dr. Aminu is asking if you pass FRCR exam, can I able to practice in the UK without going through PLAB? I think that has been addressed already. Yes, you can. But I think it depends on how soon you want to start practicing and how or what you mean by practicing. Uh, Dr. Yano, I think you should say a word on this. Yeah.
Right. So I think you still have to write the plab. Because what the plab does is license you to practice in the UK. So you need to write the plab and you need to write the FRCR to then be able to get a job as a consultant radiologist in the UK. So I don't think there's a pathway that excludes taking the plab exams, unless I'm wrong, Mayowa.
To be honest, I'm not very sure. I'm not very sure um if that's the situation.
Yeah.
I used to think that the FRCR pathway was is like the postgraduate pathway as well because some other specialties, for instance, internal medicine, if you've completed
Yeah.
your MRCPs, you don't need to do lab. So I used to think that was the same thing in radiology. I'm not very sure. If I have to be honest, I'm not sure.
We can find out and then get back to
Y-
you on that.
Yeah.
Yeah.
I think if you intend to, if what you mean by practice is practicing medicine, doing something related to medicine, and you want it as quick as possible, I think PLAB might be your best bet because in about 2 years, even if you are outside the country, if you have the money, you can easily sort out your PLAB booking. So, but if it's radiology that you want to practice, it has to be FRCR. And then relatively FRCR may be a little bit longer. It may take a longer time, probably mainly because of booking. But now 2B slots are a little bit, they are more generous with 2B slots now, save for 2A, that is the intermediate exam that still happens twice in a year. I think part one is still about 4 times in a year. So meaning that even if you get 1A, I mean, if you get one part one booking early and then 2A, if you are not very strategic with the booking, you might miss out a year, right? And as at the time you are passing your part one FRCR as well. And then for 2B, 2B booking, I think is about 4 times in a year now as well, but the slots are very competitive. So particularly if you are not a member, it's uh, almost impossible not to get a slot or maybe not on time. So And of course, unlike PLAB, it's not it's not the general medicine. It's a core specialty exam, so it requires more preparation, more dedication. So you may want to give yourself some time, really. I'm not sure if RCR is what anybody want to do in a rush, uh, because the exam will really test you. I mean, the exam will really check whether you should be whether you should be a radiologist. So there is no hiding place there. So uh but either ways you could get GMC registration. Uh by the time you complete 2B, you can do 2B registration. I mean, you can do GMC registration with your 2B. In fact, the 2B statement of results is more or less like even addressed to GMC, that this person can now, be registered with you on uh, like not a full-blown specialty registrar yet, but at least could have some general registration already. So and once you have GMC, then you can practice, you can continue with your career there. And in terms of training, even just before this year that this prioritization became a thing, you could get into ST3 training, higher training for some of us who has started our training in Nigeria or anywhere else in the world, who has at least part one already with some other requirements, publication, teaching evidences, all sort of things like that. You could get into training without GMC. Yeah, so they call it the sponsorship pathway. So after you've applied to FRCR, you've applied to RCR, I mean, and then you've been screened, you are eligible for an admission, then RCR will sponsor your registration with GMC. They will write a recommendation to GMC to give you registration. So you can come into higher training through that part. But as at last year, November cycle or November, December, that sponsorship pathway is no longer available. So anybody who coming to higher training program must get GMC, whether by PLAB or by FRCR already, which has to be 2B before you can apply for the training program. So in short, you are able to get GM registration with either ways, either PLAB or FRCI. Just that, like I said, depends on what you want to, the practice you are looking forward to, and how soon you want the practice commenced. So that's what determines the pathway you take. Okay. So Dr. Nowadays is also informing us that the current booking is for 465. So, and that is, I'm sure by next year or later in the year is going to be, or next year usually, if the current booking is 465, that's what it's going to be for the rest of this year. And yeah, okay, even this, I'm not sure if this is just for members or non-members. For any information that has to do with this, please just go to RCR website. And they've made it so nice now that it's easier to navigate than before. So all the information will be obtainable there. But I doubt if the exam is ever going to be getting cheaper. Yeah. Okay. At this point, we must express our unreserved gratitude to Abdul-Sabr Mayowa and Dr. Oderinde Iyanoluwa. If it's possible for you to, any one of us, to use our electronic applause, please let's give them some applause. We appreciate your coming and for enlightening us on this subject. I mean, we've not only been informed, you have also inspired us, Um, by your talk. We really appreciate that. Thank you so much for obliging us. And then general announcement is that the membership form is up in case there is anyone joining who is not a member of REGAF. This is not RCR membership. This is REGAF membership. For your information and then access to Regal folder. So please use the link and then you will be right in with us. And so I guess that's all. I'm not sure if the program officer is on the call. Dr. Naade, is there something else you may want to say before we call it a day?
No, I think you covered it all. And thank
Okay.
you to our able host, Dr.
Yeah.
Babalode,
Ah.
for stepping in last minute.
Now, so thank you for the opportunity.
And
I
thank
hope
you
I've
all for
made you
joining.
proud. The
You
real
have, you have, you have.
anyway. All right, thank you so much. So thank you all once again for coming. We hope to see you at another time and in our next webinar. Thank you very much. Thank you all. Bye. Yeah.
Bye, everyone. Please join the
Yeah.
link and join the WhatsApp groups
Yeah.
for more information and
Yeah.
resources.
Yeah. Thank you. Yeah. All right.